Hare Krishna. On behalf of Bhaktivedanta Hospital Research Institute, I welcome all viewers for this interesting online session on healthy heart. This session will be conducted by Dr. Sandeep Patil, who is the HOD of our cardiology department. Dr. Sandeep Patil has an experience of more than 13 years and he has been associated for many years with us. So today's session will be an important session wherein he will be talking about giving you many tips on how to take care of your heart. So please do not miss this session. Please pay full attention and take maximum benefit of this. Over to you, Dr. Sandeep Patil, for this presentation.
So today I am here to have some sharing of the knowledge with you regarding the heart problems and how to keep your heart healthy. That is a primary aim of our today's scientific discussion. I will call it as a scientific discussion because nowadays you might be hearing the cases of heart attacks in a relatively younger patients, what we were not seeing 10-15 years prior, and the incidence of sudden cardiac deaths have also increased if you see the data also. So there is much need for awareness regarding the heart problems in the society, so that we can know the disease and we can guide the patients in a right direction. So and that definitely I can assure you this will definitely a treatable problem and it can be prevented also, and it can be well treated if we are aware of the disease. So that is how this session was organized. And first of all, heart is a very important organ. Heart is the most hard working organ of our body. It pumps around 4 to 5 liters of blood every minute and it doesn't rest. Believe me, it works right from the womb of the mother till the death. So such an important organ, so we should keep it healthy. So it supplies the nutrients and oxygen rich blood to the all parts of the body. So coronary arteries which supply the heart, they surround the heart and they nourish the heart. So this is how heart is working. So why this problem is important? Because developing countries such as India, the incidence of these heart attacks have increased in recent times, and our blockages are different from the other countries if you compare with the Europe, China and the Western countries, because we are getting this disease 1 decade prior, and the amount of disease, that is the burden of the disease, is quite high. We are getting multiple blockages, diffuse disease, all the arteries are blocked. Incidence of deaths because of these heart attacks are high in India as compared to the European countries. If you see the European countries, we have 3 times higher incidence of death because of the heart attack. If you compare with the China, it is 6 times more. If you compare with the Japan, it is somewhere around 15 to 20 times more chances of deaths because of the heart attack. So that is the scenario in India. Science has so advanced that we can treat the disease well, but still we are lacking behind to prevent this disease. That is how in Bhaktivedanta Hospital we sat together, all the departments like Ayurveda department, like dietitians, like physicians, like endocrinologist, cardiologist, and formed an integrated medicine department. The purpose of this is to identify and try to prevent all those severe form of coronary artery disease, so that the mortality as well as the morbidity because of this disease is reduced. So what is exactly is the blockages, that is atherosclerosis. If you see the coronary arteries, there is right from the age of 2 years, there is a starting deposition of this cholesterol. So the high cholesterol, once it flows in the blood vessels, and it gets deposited in the wall of the blood vessels. So gradually there is wear and tear, stress form is there at that point, and deposition of some other cells also, like platelets, deposition of smooth muscle cells, and this is how this cholesterol with all other elements, they form this block, what is called, we call it as a lesion, coronary plaque, which advances and narrows your coronary arteries, and this is how the blood which is flowing through the coronary arteries, that gets hampered. If the stenosis is more than 70%, then definitely you will not get adequate blood while you are exercising, because demand of the heart increases when you exercise. At that time you require more blood, heart require more blood. But if there are blockages which are more than 70% inside the coronary arteries, then this blood supply is not adequate during the exercise. That's what initial stage patient may feel pain only on exercise. At rest he may be normal, she may be normal, but when they are exercising they feel pain and they stop exercising. This is how the progression of this blockages happens. Wherever this medium to large size vessels are there, these blockages, the nature of the block is same. Whether they are in the heart, whether they are in the brain, they will cause stroke. Whether they are the arteries which supply our limbs, then they can cause gangrene of the limb. We can lose, a patient can lose the limb if we are not taking care at a time. So if you see the symptoms as I already described, it starts with the chest pain. Okay, the pain is on the left side of the heart, because where the precordium, that is heart, is situated on the left side of the chest. And this pain is something peculiar because it is a squeezing or compressive type of pain. Somebody is squeezing your chest, and this pain will go on radiating to some other parts also, medial aspect of our left arm. It may go to the neck also, but primarily the pain will start on the left side of the chest. And any physical activity like walking or any physical activity increase the pain. So initially the patient might feel this pain only on exercise. This is called as a stable coronary artery disease, stable angina. But over a period of time, this may progress to pain at a rest, that is called as unstable angina. But if it further escalates, then it may damage your heart muscles and it will cause a heart attack like situation. So we call it as a non-ST elevation or a ST elevation heart attack, that is myocardial infarction, where the heart muscles start getting dead. So because of the lack of the blood supply, and you may feel breathlessness also, you may feel sweating also, and palpitations also at the same time. So this is how, and even 25% patients, they don't reach hospital in a massive heart attack. The patient can die if the treatment is not taken properly and on time. So as I said, this is the number one problem in the world, and most of the deaths all over world, they happen because of the coronary artery disease, that is heart attacks. So there are 12 million deaths annually we get from the heart attacks. And during last 30 years, large decline in developed countries, but in developing countries, this problem is increasing. In developed countries, there is a lot of health awareness, and the government programs are there to make people aware of this disease, because this is called as a lifestyle disease. So what is lifestyle disease is when your lifestyle becomes bad, then the diseases, they will progress and ultimately they will culminate into a heart attack. So we should focus on our lifestyle. In later part of our discussion, we will go on to the what are the good lifestyles, what are the bad habits that we will see. And there is alarming increase in number of patients of heart attacks in countries like India. So you may be surprised why we are discussing I am healthy right now, and why we are discussing all this, because nowadays we are getting younger population. So there were studies conducted even in India, like in AIIMS hospital. Those who were brought dead because of the heart attacks, they were studied, 2,800 such cases. They have found that only 10% patients, they got a golden hour treatment, that is first 90 minutes. They could able to reach the hospital and get treatment. Rest 90% they didn't get treatment on time. So this is how the lack of awareness, people don't recognize those pain and they ignore those pain, take over the counter medications. That is how this may hamper the prognosis of the disease. So this is there is a genetic predisposition to this disease also. It may run in the families, and there are lots of other causes like lifestyle, bad lifestyle, as I already said, poor handling of the diet, that is more saturated fat, trans fats, then the metabolic problems like diabetes, blood pressure, high blood pressure, overweight, obesity, then lack of exercise, lack of fruits or vegetables in our diet. Stress is another important factor, lack of sleep. A 7-hour good sleep is ideally recommended for all our patients. Then there are certain environmental factors also now they are studying, like change in temperatures, pollution, urbanization, as we said, change in lifestyle that has culminated into these diseases, because now young generation, they want all the high fat diet like pizzas, like burgers, and like the cold drinks, carbonated uh, liquids. So they are high sugar content, they have high sugar content and lots of chemicals. And smoking is also an important bad habit, which is directly responsible for formation of blockages. High dose of alcohol, then there are cocaine also is one of the drugs which directly causes heart attack by narrowing the arteries. So there are many factors which we should look for why our young generation is coming with this problem. So we need to change our lifestyle. We need to go into what we say the ancient form of lifestyle, I will say, because previously after the sunset, people used to stop their eating and have a good sleep, and early they used to go to the bed and early rise from the bed. So that is how you can keep your heart healthy. So who are at risk? I will say age is also a risk factor. The men more than 45 years, female more than 55 years, and family history. That is, if your father gets blockages at the age of before the age of 55, or your mother gets a blockages, father gets before 45 or mother gets before 55, that we call it as a family history. And if you have a high cholesterol, smoking, high blood pressure, diabetes, obesity, high consumption of alcohol, then definitely we are at risk of this heart disease. So if you see the cholesterol, generally we do health checkups to find out, because high cholesterol initially doesn't have any symptoms. That is a problem why people miss all those high blood pressure, sugars and the cholesterol. The initial phases, they don't have any symptoms. So that's why a regular health checkup is recommended. So we should know what are the parameters in cholesterol which are important to look for even as a lay person, because we look for 4 parameters. LDL is a bad cholesterol, total cholesterol is also bad, high triglyceride is bad, but the HDL is a good cholesterol. So that is how we need high HDL levels in our blood and low LDL, total cholesterol, triglyceride level. If you think of cholesterol, there are 2 sources of cholesterol. One is external source, that is food. If our food habits are bad, we are using trans fats, we are using high saturated fats, then our body cholesterol will go high. But if we are sometimes people are surprised, my diet habits are absolutely fine and I am doing exercise, still my cholesterol is high. So these are another group of patients where there are genetic changes in your body, enzymatic changes, where body's enzymatic changes will cause a rise in the cholesterol. In such cases, definitely along with this lifestyle, what we have to continue and give some medications which will reduce the high cholesterol level over a period of time. So food sources, definitely, as I said, they are important for reducing the cholesterol. So LDL, as I already said, is a bad cholesterol. We should have a less than 130 in a patient who doesn't have any risk factor, or less than 100 values in patients who have diabetes, who have blood pressure, family history. Then obesity is another, we don't call obesity as a problem in our society. We accept it. That's a problem. Obesity is a disease. Why don't we see it as a disease? Because if you see the obesity is what? It's a deposition of fat inside your stomach, or around the stomach and in the abdomen. And that fat ultimately is an indicator of high cholesterol in your body, or that fat gets deposited in your vessels. So obesity patients have 2 to 6 times high risk of developing heart disease. So that is how we should take care of reducing the weight. A simple formula I will tell you: after the age of 40 years, you should measure your height. Height in centimeter minus 100 should be our ideal weight. If our height is 164 centimeter, then the weight should be 164 minus 100, comes to 64 kg. Plus or minus 1 or 2 kg is acceptable. So this obesity problem, we should recognize it early. Nowadays we are getting childhood obesities, that is more dangerous. So we should prevent all those who are going to school with and in and around and eating the junk food like pizza and like burgers every time. So we should definitely reduce those high fat foods and start exercising. So physical activity is important. So in physical activity, what I will say is ACCAC, our highest governing body, that has the guidelines. Endurance exercises, I will recommend brisk walking, cycling or swimming for those patients who have a diabetes, blood pressure, or otherwise also normally, to protect your heart, to bring down the blood pressure, to bring down the diabetes. At least 150 minutes of moderate intensity exercise in a week, that comes to around 30 minutes 5 days a week. So at least ideally in a healthy person, you should have 10,000 steps per day. Now there is a calculation of steps, but if you could exercise at least for 30 minutes 5 days a week, that is also enough. If you ask me timing, a comfortable timing, either early morning timings are better. So if we can finish in that, so that's a good time. And second thing is yoga, pranayam, definitely that helps the heart. There are studies which brings down the blood pressure, makes your heart rate stable and reduces the chances of heart attacks also. That is also recommended. Then comes to the bad habits. If you see the cigarette smoking, that is quite common in young population also, that has a direct effect on the heart. The other organs like lungs, any other system is affected, but heart is affected equally. If you see the effects of the nicotine which is there in the tobacco, that causes a decrease in good cholesterol, it increases the bad cholesterol, it damages the arteries, which will increase the heart rate, and you will have more chances of heart diseases. And that cigarette has more than 200 damaging chemicals inside it. They are poisonous. Everything is written on the pockets also, cigarette cancers and all. Still the people, the incidence of smoking quitting is not increased. So that's an alarming increase in rather smoking, though we should bring it down by alcohol consumption. Definitely nowadays there are new studies that even a small quantity of consumption of alcohol is not good for heart. Initially they were 1 or 2 packs they were saying initially, but now new studies, they don't recommend even a small quantity of alcohol. Another important risk factor I will say to reduce all the heart problems are diabetes. So it's a very high incidence. If you see the recent ICMR data, 12.5% of Indian population is diabetic. We are the capital of diabetes in the world. Second thing is pre-diabetic stage. So there are patients who are frankly diabetic, and one stage is that they are pre-diabetic. Almost 12.5% patients, Indian population is pre-diabetic. How they are decided? There is a test that is called as HbA1c, which is an average of 3 months of sugar. If that HbA1c is less than 5.8, we are non-diabetic or neither pre-diabetic. If it is between 5.8 to 6.4, we are pre-diabetic, likely to get diabetes in future. If the value is more than 6.4, we are declared diabetes by all the definitions. So diabetes increases 2 to 3 times risk of heart attacks or strokes. 80% of diabetes patients, they die because of the heart problems. So there was a Finnish study which was conducted, which clearly says that diabetes is equivalent to coronary artery disease. That means those who have diabetes, they are bound to get heart blockages during their tenure of life. So this is how diabetes is important. It's a root cause of all the heart problems, blockages. So we should control the diabetes. There's no way we can remove the diabetes entirely, but we can control the sugars by taking diet precautions. We should avoid sugars and we should exercise daily, take proper guidance from a physician, from a diabetologist, endocrinologist, have a regular checkups of blood sugars. So this is how we can control the diabetes and reduce the incidence of heart attacks. So most important thing in our society is surprisingly in our country, consumption of fruits, vegetables is little less as compared to the other countries. So in counter, what we see is when the person is hospitalized, then we are taking all those fruits to as a gesture for visiting the patients. So rather, I will advise eating fruits on regular basis will reduce the incidence of admissions to the hospital. So at least they recommend 5 servings in a day of all the fruits are equally effective. Pomegranate has a little bit highest value as nutritive value as compared to the heart. It keeps your arteries healthy. And eat colored vegetables, eat fruits, variety of grains, whole grains we should eat, not the atta, maida or like that. We should have less fat in our daily non-veg. I will not recommend. It's not good for the heart also. And switch to fat-free milk, that is toned or skimmed milk. So as far as the salt is concerned, definitely there are three triad we should take care of: sugar, salt, and oil. So all three are there for increasing the taste of the food, but if you see their nutritive value, definitely in excess quantity they are not good for the heart and the other problems also. So the salt also less than 6 gram in a day is recommended. So if you see the food which is there, so we should avoid fatty foods. Desi ghee, if you see 1 teaspoon is enough. Butter, cheese, malai, rabri, or ice creams, we should avoid it. And bakery products, cakes, pastries, that has high cholesterol levels, so we should avoid it. If you see the cooking oil, the dietitian, our Vaidhi Mataji must have explained all the things, but by and large I will say avoid the palm oil and coconut oil for cooking. Rest of the oils, they have equal nutritive value. The quantity should be less. The message is quantity should be less. Why? Because if you see the incidence of heart attack in India state-wise, highest incidence is in Kerala. Why? Because traditionally they eat more coconut oil. So that is how coconut oil and palm oil we should avoid. Because if you go to the street food, majority times it is a palm oil and they are reusing the oil, and that increases. If you heat the oil repeatedly, it will increase the trans fat levels inside the oil, and that is how the fat content will go up and we may land up in cardiac problems. So exercise, I have already explained that, and the benefits of exercise to reduce your heart rate, reduce your blood pressure, increase the good cholesterol, decrease the bad cholesterol. So just walk is the message, my message for the heart, for healthy heart. Quit the bad habits if at all they are there, smoking, tobaccos, and you should know your cholesterol levels. What are the cholesterol levels we should keep? So our total cholesterol should be less than 200, triglyceride should be less than 150, the LDL, which is bad cholesterol, should be less than 100, and good cholesterol should be more than 60. Then the blood pressure also, as I already said, it doesn't have any symptom. So we should at least get it checked at least once in a year if we have a normal blood pressure, or those who are hypertensive, they should have a regular checkup of blood pressure. So we can have a digital BP machine for those patients who have blood pressure, and our normal BP value ideal is 120/80, but by guidelines 130/80 is recommended for all those patients who have a blood pressure. So as I already said, control your sugars, try to reduce the weight. I have already told you the ideal weight for a patient. So if you have someone who is a first degree relative and has a heart problem like blockages, angioplasty is done, bypass is done, then definitely those relatives or first degree patient relatives should get their all routine checkup done. What is that? Is get your sugar checked, get your blood pressure checked, get your cholesterol checked, see whether you have any bad habit, see whether you are eating proper food, see whether you are exercising daily as per the recommended given timing and given kind of exercise. Is your weight is in control? If is there any stress level you have, reduce it, domestic as well as professional stress. You should have a good sleep, at least 7 hours, have an early dinner, and then if you have diabetes, get your advice from the concerned doctor, have a regular medication, don't stop it unless the doctor says. And the diet, and this is called as lifestyle modification. If you have a lifestyle disease, then first thing will go is lifestyle modification, diet, exercise. And if it is not controlled, then definitely we have to take help of medicines. So we as a integrated medicine department trying to cover the allopathic component also and the ayurvedic component also, as well as the diet, exercise, and our traditional ancient treatments like yoga, pranayam. All this will help to the cardiac patients. And but definitely for those who have already been started on medication for post angioplasty, pole bypass, do all lifestyle modification, but do not stop medication without consulting the cardiologist. So that is a message to all those. So once you recognize somebody is getting a heart pain on the left side, and that pain as I described is increasing, then first thing you should do is give rest to the patient. Don't exert or don't ask him to walk. Give him rest and take help of the health system. You should go to the nearby hospital, reach there, get your investigation done like ECG, like blood pressure, like oxygen levels, and take the advice of the doctor. If you reach within 90 minutes to a proper hospital post heart attack, believe me, chances of losing life are very, very less. Unfortunately, in India, we don't reach in on time. Either ignorance from the patient side or lack of facilities is another problem. But definitely nowadays facilities are increasing towards the rural areas also. ICCU setups are there. So go to a proper doctor. It's a treatable disease, believe me, and we can have a healthy and a fruitful life if we take care of all those what we have discussed today. And definitely there is a role of spiritual health also. We have spiritual gym here, and there are spiritual counselors also we have, and they give because see, any satisfaction levels, ultimately the heart will be happy, your heart rate, your blood pressure, cholesterol levels will be within check. So you will require minimum allopathic medications, but if needed they do, we have to continue that. Daily exercise. So final take home message is, don't ignore the things. Symptoms you should recognize of heart attack, the causes of heart attack, daily routine exercise, diet for all everybody. And if the family member is having heart problem, then be cautious, get your everything checked. Like we have a packages for health checkups also that includes concisely all the blood investigations and cardiac investigations which are required for those patients. So at least once in a those who have a family member of heart problem, once in 2 years, or those who have no disease like diabetes, like blood pressure, then once in 3 years, 4 years, we should get our health checkup done. So Hare Krishna, thank you.
Thank you very much, Dr. Sandeep Patil, for today's important session. As I said in the beginning, that this would be a very interesting topic for today, and I hope that everyone has got some vital tips on how to take care of their heart. So this program is a part of ISKCON Devotee Healthcare Services, which is launched by Bhaktivedanta Hospital and Research Institute as a part of 25 years of completion. This program is specifically designed for devotees so that they take care of their health in all aspects and be better prepared to serve Srila Prabhupada's mission. So, in case anybody in your congregation or group or any community wants to conduct such sessions, please do contact us on the numbers mentioned. on the screen as well as in the description. So finally, once again, I thank Dr. Sandeep Patil and all the viewers who have attended this. Stay healthy, stay blessed. Jai Shri Prabhupada.